guess the next question is, what are the questions that the patient needs to ask that, and what questions do you wish they would have asked you early on in their recovery? And what is the outline that you suggest to patients now when they are discharged, what their responsibility is?
I think it's a really, I think this is a great opportunity to talk about why education is so important, right? Most times, these types of catastrophic changes are unexpected and never desired. So I think it's good to note the natural progression of recovery, and that includes just understanding what's happening to your body, right? So I would say, um, just to encourage more grace as somebody who just recently survived something, like a neurological event. Be graceful in that sense that you don't have to worry about hitting a checklist and making sure that you do things on a list from A to Z, but really just allow yourself to heal emotionally, to accept the changes that have occurred. Okay. And then so when you're ready, I think it would be good to talk about what it is that defines your current status right now. What are your current impairments? What is it that you could do in your daily routine, right? Try not to identify as a patient, but think about what you have to do to reclaim your sense of independence. Whether it's, X amount of minutes spent on an exercise, or how you can turn those exercises into a functional task, right? So in the hospital, you might be committed to a specific schedule for therapy, but maybe consider how can you turn therapy into your home routine, so you're basically hitting two birds with one stone, right? You're
Right.
trying to not only work on your bicep curls, but how can you work on your bicep curls as you're doing laundry and loading the machine or unloading the machine, right? So talking about that practical application, and already essentially like taking that baton from the therapist and taking it into your own hands, where you're preparing yourself on the next steps that you need to take to further progress your recovery process.